Good morning. It's my pleasure to join you today for this really important conversation, and I am deeply grateful to have been asked to be a part of this panel. What I'm going to do with you today is talk with you about what we've been learning at PolicyLink as we've been engaging in this work over a number of years to improve our communities and our individual health by using place-based systematic change approaches. And so our Center for Health Equity and Place has been involved with a number of initiatives and partners across the country, and we're beginning to learn some things that we're really wanting to share with you. Basically, when we talk about health equity, we've got to go back to understanding how we define health. And health for us isn't just an absence of disease, of illness. It is about one's overall state of well-being, and that includes economic well-being, physical well-being, social well-being, and spiritual well-being. When all of those things come together, then we can have some markers for health. And so when we want to talk about how we define equity, at PolicyLink, we define equity as fair and just inclusion so that all can participate and prosper in this country. And achieving equity isn't going to just happen on its own. It has to have an intentional focus. We've got to be very strategic and very committed in our need to explore what we can do individually and collectively to attain this state of health and wellness. And so this is just a very simple graph that I created to show what we talk about, what happens in communities of opportunity. Those are communities that are thriving, vibrant. They've got grocery stores, they've got Farmer Joe's and Whole Foods and all of those kind of choices that you could make. But in the low-income communities, they have fast food restaurants. They have mom and pop stores that don't have a range of goods and services. And so, again, in those communities of opportunity, you have thriving financial institutions. In the low-income communities, you've got check cashing places. You've got predatory lenders. In the community's opportunity, you've got well-performing schools that offer AP courses to their students. In low-income communities, many of them don't even offer AP courses. So when students think that they're smart and they're getting A's, that A is not an equivalent A to the other schools. And when they get to college and they realize that they can't really compete, it's not because they're not smart, it's because they didn't have opportunities provided to them. So all of the things that we're talking about, having good transit that can take you to your jobs, that can take you to the medical appointments, that can take you to get groceries, good full grocery stores. If you don't have access to transportation, then you're without those opportunities. So what we're trying to say here is that not that everybody in opportunities of community have good health, but we're saying that you have better opportunities to be healthy. And that those who are in lower income communities that don't have those basic opportunities tend to be at a greater risk for health. And I'm just going to pause here and talk a little bit about how I got involved in this work that I've been doing for, 30 plus years. And I go back to when I was the director for the Oakland Healthy Start program, and that's a program to reduce infant mortality that began under the first Bush administration. And we realized back then in the 1990s that the conditions of infant mortality was not going to be solved by just having more clinicians, by just extending the clinic hours. We did all of those things, but what was really clear in First President Bush is that we were given funds to change the environment in which those babies were dying. And what I can stand here and say today is that many of those communities in that first cohort, there were 12 places across the country that were funded. Many of those are the same places that have high obesity. They have high diabetes. They've got high crime. They're the same programs that are now funded by these innovative programs such as Place Matters and all of these wonderful programs. We're still now trying to change these same environments. So the one message that I'm wanting to make sure that we get here today is that this is long-term work. And when we start talking later about measurement, we've got to take that into consideration, that we're not going to get immediate impact by just addressing one disease at a time. When you change that environment where all of those things are happening, then that's when you begin to see the long-term changes. So as we start talking about why making the case for equity and why now, you know, we are familiar with all of the statistics about what's wrong with what's happening with these communities, that we're not trying to say that this is a new situation, but it's a dire consequence now when we look at how we are underperforming in our society, that our children are not getting the kind of attention that they need in order to thrive and to be the future leaders that we need for them to be. And so, and you all are all familiar with obesity statistics, so I won't linger here, but we know that the consistent theme here is that communities of color tend to have, again, the highest rates of obesity, as we had the highest rates of infant mortality and all of these other indicators. And so something has to change environmentally and systemically in order to make the change happen. And so again, you're familiar with all of this. I don't have to spend a little bit of my time going through this, but I just want to just point out why it's urgent now. And we looking across the country at where the states that are having these highest rates. And, you know, so that's when, again, we were talking about taking things to scale, that we've got to focus not around providing the same amount of resources across every place, but we've got to concentrate those resources in the places that have the highest incidences of these issues. And so here is something that we all know, basically, but it's just pointing it out clearly, that the more education we have, the longer your life, the healthier your life, the more opportunities you have. And so we've got to figure out how to address these issues around income inequality. That's another one of the reasons for the urgency now. And so as we started to take a look at how are we preparing for our children of the future, I'm going to also pause and say that PolicyLink has been involved with a project with the University of Southern California, Dr. Manuel Pastor, around looking at how our country's demographic shifts are changing. And what we know is that by 2040, we will be a majority country, people of color. And a lot of that is being driven by children that currently, there are 4 states that are already majority people of color, and it's because of children who are being born to people of color, predominantly in Latino populations, are the largest populations. So California, Texas, Hawaii, and New Mexico already currently have people of color. So if we don't pay attention to the fact that how are we nurturing these children who are going to grow up to be the leaders, if we're not preparing them for the jobs of the future, then we're not really doing our job well. So what we realize here is that what this is basically saying is that most jobs of the future will require at least an associate degree. And so we've got to make sure that we're training and preparing our students to meet those needs. And when we take, again, to take a look at what are the actual jobs of the future, who's going to be hiring, these are jobs that are predominantly into the health professions, which is very good for those of us in healthcare. But what this is basically showing is that there's less jobs around manual labor. And more jobs will require analytical thinking and administrative skills and being able to problem solve. And are we doing our job in preparing for these jobs of the future? And what do we need to do differently now to prepare for our children to be healthy? So basically what my message in all of this is that all of these things are about health equity. Because if you're not prepared, we know that education is a major equalizer, that can get you out of poverty. And so if we're not preparing people to be able to move out of circumstances, then again, we need to take a look at what we need to do differently. So I'm going to be talking a little bit about institutionalizing health equity. Basically, we are involved in some research underway at PolicyLink, where we're taking a look at places that are across the country calling themselves institutes of health equity centers. We were really curious about what are these places as we start to hearing more about these emerging centers for health equity. Are they doing the same thing? What that work involved? Who's funding them? What are their outcomes? Who are their partners? So we've been involved with looking at across the country, beginning with public health departments. There are some really progressive public health departments that's really going beyond their mandate. And what we're learning from them is how they've been able to change those institutions to address more around health equity. And so what we've learned is that when we talk about how do you institutionalize health equity, we need to be more intentional about inserting goals to achieve health equity in all of our policies, programs, and practices. We've got to have an intentional focus on race and place in crafting policy solutions. We've got to make sure that we insert equity in our developing research agenda and our policy options. That we've got to begin to figure out who are these centers that are doing this health equity work and how do we support them? What are the resources that they need in order to move the needle on some of these issues? And so I've broken this section up into several categories. So again, it's very few people who don't agree that we should be focusing on health equity. The challenge is, how do you make it happen? How do you change something? What do we need to do differently? And so there are a number of strategies in each of these categories. I'm only lifting up two in the data collection and analysis. How are we identifying the indicators that's being used to really understand the health inequities in these communities that we're focusing on? Then who's the most impacted? And then where are the inequities most severe? That's in your data collection and analysis stage. When we're looking at our strategy development, what equity outcomes are we seeking to achieve? And who's intended to benefit from these strategies? These are all questions that we're asking you to consider as you're beginning to craft strategies around addressing health equity. And ultimately, how will this strategy benefit the communities that we're most trying to impact? And how does this help to achieve greater racial and economic equity? And then basically being willing to look inside ourselves, our own organizations. What practices can create barriers in achieving racial and economic equity? We talk about those unintended consequences. How can we begin to focus on what those might be? And then this is a key piece that really must be considered. The degree to which we actively engage community members in our practice and policy solutions. Again, there is hardly anybody who would disagree on the value of community engagement. The challenge is, how do we engage communities in a substantive way? What are the opportunities are we creating to make sure that we're involving those in the crafting of solutions? And so this is another little image that I created, which shows basically the ladder of influence around community engagement, because all involvement is not equal. So what we've realized, again, let me just, around the Healthy Start story, I came to PolicyLink at the request of Angela because she was on my advisory board during the Healthy Start years, and she wanted to know, she wanted me to be a part of a research project along with Mildred from UC Berkeley, who just retired, who was a partner with us in all of this work, to create a methodology to figure out to what degree that requiring community involvement make a difference in the outcome of the Healthy Start programs. And we did a 2-year study which basically demonstrated that the substantive involvement of community members made a major difference in program outcomes during that time. And that those programs that had governance level involvement, which meant that people who were from the community that had an ability to have a decision-making role, the higher level of engagement created the most impact around program involvement. And so this is basically just showing that there are many levels of community engagement. Governance level at the top, and at the least is having a town hall meeting once a year in which you bring the community together to talk about what you're doing. That has the least influence. And so there are all kinds of things in between there that we can create to make sure that we have community involved at a level that's going to be a substantive engagement process. And then this other area is around capacity building. To what degree, when we involve communities, are we giving them the capacity to build their skill level? And what opportunities are we being created to make sure that staff understand the need for focusing on racial and economic equity? So, some of the solutions that we've been focusing on in doing this work. I'm beginning with everybody, most people in this room are familiar with what began as a Pennsylvania Fresh Food Financing Initiative that's now been taken to scale to be the Healthy Food Financing Initiative. In California, it's called the California Fresh Works Fund, and this is a picture of Michelle Obama coming when we were just creating that fund. And so this is a wonderful example around cross-team collaboration and the public-private partnerships that we're wanting to focusing on today. It's a wonderful example of showing how the California Endowment with seed money was able to begin to launch this initiative that now has substantively had much bigger impact and involves not only businesses in terms of banks and community organizations, but it also allows individuals to have a role to play by investing. So that's the best way around building wealth in this country, is understanding how do we begin to really make a difference here. And so these are other opportunities of what we need to do to have impact around improving our communities, and to look at how do we make sure that we involve a range of efforts. We do a lot of work around converting local stores, where we're not trying to put businesses out, entrepreneurs out of business, but how do we convince them that they should have healthier products, and how do we help them to figure out how to make those changes happen. This is another example that we've been focusing on. I'm a Kaiser member, and I had noticed, sort of like the doctor has been asking me, okay, how often do you exercise? And I didn't realize that that was an intentional strategy that Kaiser adopted. I thought it was just my doctor being concerned about my health, and you know, I'm sure that's the case as well. But it was really nice when I realized that this is an actual strategy. Exercise is a vital sign. And so this has come to be a really productive strategy for Kaiser, in showing how just by asking key questions, it's motivated clients to want to be healthier and to make a difference in their own health care. And so as I was starting to research this work that was being created by the American College of Sports Medicine, saying exercise is medicine, I was realizing, you know, they're saying there's heroic power in exercise. You know, you can reduce diabetes, you can reduce blood pressure and stroke, but when I also saw that it decreases school suspensions and reduces the risk of death, who wouldn't want to be physically active? So how do we make sure that we incorporate physical activity as a vital part of all of our work? And so what we've learned that framing is important, that we've got to focus on not looking at the individual, but looking at how changes must be made in the environment, less blaming the victim and figuring out what are the things in the environment that must be changed. That partnership matters. These are all things that we're aware of. And we've got to understand the context. When is it going to be productive to introduce a new idea? When do you involve partners? When can you move a strategy forward? It's all based on the environmental context. And we must consider all of those things in crafting solutions. We've got to make sure that we understand that assessment is critical. We've got to continually figure out how we are monitoring our work and doing things differently. How do we continually build capacity, not only with the environment, but also among our staff and our partners? And how do we tell our story in our own way? How do we make sure that we are the storytellers of this work, that we don't leave it to anybody who wants to just do this work? And I also just wanted to mention this amazing work that we were a part of with the California Endowment, their Healthy Eating Active Communities work. That was, again, long-term work that was built upon by a strategy that they had in place long before they created this obesity strategy, and it's continued now in their Building Healthy Communities work, again, making the case for we've got to begin the foundation and build upon that foundation. And it showed a lot of amazing success over a period of time in their evaluation strategies. And I won't read them all for you. You can go online to read about this. But I wanted to lift it up as a model that I thought really had major impact, and it had a major evaluation to go along with it. So we saw major changes happen happening as a result of these strategies that were put in place across the state of California. Now, as I wind down, I want to begin to talk about what we've identified as ingredients of success in doing this work. That when we did the research with the public health departments and these other groups that have been able to move the needle, there were certain themes that kept coming up that we had to pay attention to. And that the programs that had the biggest impact all had, to some degree, these ingredients of success. One was strong and sustained leadership. Having a visionary leader who was bold thinkers, who were thinking outside the box, that had a commitment to work across sectors, that they engage broad community representatives and schools and hospitals and all kinds of ways to look at different collaborators. That the strategies had equity-focused strategies that were a part of how they created their work. That they were creative in their use of data. How do we use this data to really make a compelling case for why we must make changes happen in our environments? We also saw that there were many strong partnerships with government and communities, where there were people who really felt the need to go beyond. And I'll just give one example of this, again, piece of work. In Alameda County Public Health Department, a number of years ago, when we were in the middle of the housing crisis, and there were a lot of people who were losing their homes, we had also slumlords, basically, who had bought up properties. They put people in those buildings, and when the housing crisis was at its worst, they just walked away from those buildings, leaving tenants in those places, many times without adequate infrastructure. And as a result, there were some places where they had the water shut off. They just didn't have the kind of amenities. And that public health department worked with an advocacy group to begin to show how that housing crisis was a public health issue. So how do we make sure that we are framing this work in a way that we're looking at creative partnerships, and through that effort, we were able to make some major changes in how people saw that issue, and there were some changes that we could make in our environments. And again, this piece around adequate resources, we can't do this long-term system change work with a 2-year grant for a few $100,000. It's just not going to happen. We've got to make a case for why there has to be adequate resources and support, and there's got to be a long-term engagement. And this can be a place that can be challenging sometimes because funders often want to see some results from their investments. But we also have to make sure that there is an attention placed on making sure that we can measure and document this over the long haul, because we know that we're not just going to change BMI rates. But how do we look at those other interim goals? How are we making sure that we can measure getting community more involved, or getting to see the degree to which schools are making changes in their cafeteria choices and those kinds of things? And how do we make sure that we're constantly improving our health? And this is the website that I encourage you to go to around our Healthy Food Access portal, which can give you lots of information about how to make changes in the food environment. And with that, I thank you very much.